this is Daniel Shaw from dentalholiday.co.uk. I'm here today with another email inquiry from one of our patients who has just been to Hungary for a consultation for implants, and the dentist there who was treating him very rightly recommended that he should have a bridge of 6 points and 4 implants, and he should make 2 visits, the first visit being around 9 days, and 6 months later another visit of around 9 days. We used to do that whole system about 2 years ago until I started talking to my patients and realised that a lot of them couldn't take off 9 days from work at a time, and then 9 days again 6 months later. That's all their holiday leave, you know, just gone on dentistry. Of course they want to be off somewhere a lot nicer than going to the dental chair on their holiday. So we developed a system that's a little bit simpler and I think better. Let me tell you just a little bit about it. I'm just looking at the email because I wrote it here for him. Now, the healing time for the bottom jaw and implants is around 3 months and the upper jaw around 6 months. Usually there's no real way to speed that up. And the other thing to think about on the first visit is that when you have implants put in, we have to put in then stitches, stitch up the gums a little bit, and those stitches have to be removed around 7 to 9 days after implantation. So I imagine that the Hungarian dentist was suggesting that they stay around so that the stitches can be removed. That also can happen here, that's not a problem, but most of our patients save money on the implants. The stitches, I think in England, to get your stitches removed is somewhere in between £8 and £16. It can be done by, of course, by your dentist, by a local doctor, also by a local nurse. In most cases they fall out anyway during that week, but it's just a safety precaution or a health precaution that you go and get them checked out. And that can be done at home. There's no reason for you to stay here abroad and pay accommodation and just wait for you to get your stitches out. You can have that done at home if you prefer. Now, the problem was that when the patient returns after 6 months, if any complications had occurred during that time with the implant, it's already too late. We'd have to make a modification, and then more months would be needed for the healing to occur. And the other thing is, for very healthy patients and in patients where the implant process had gone really well, the bone had healed so well over the top of the implant, we had to cut into the bone again to get to the implant to fit the crowns on top of it, or the bridge on top of it. So we solved this problem by asking them to come back around 2 or 3 months later, where we check on how well the implant's healing, make modifications if needed. We can also at that stage add a better temporary bridge or a better temporary system, so you get the real feel of those teeth that you're going to have back in your mouth. The other thing is that we can also check on those patients who are healing a lot quicker than usual, and we can invite them to return back instead of the usual 6 months, sometimes 4 or 5 months. So we can invite them back earlier to get the final crowns or the bridge work put on there. Also, for me as the patient manager in this clinic, it's great when I can meet the patients on a regular basis. We can work out what's working and what's not working, and I build a much better relationship with these patients this way than meeting them at the first visit and then 6 months later. We see so many different patients every day here that it's difficult to keep track, so I like to see now and again that patient, just to build that relationship. I think it's also important for you if you're coming out here. And the last visit, when we put on the permanent bridge, all the permanent crowns on that implant, that's around 4 to 5 months later. And all these visits, instead of waiting around for six days for us to make the impressions and then come back, and 6 days later after the labs have prepared the material and fit it, if you've already come these 3 times, we can just make it into each time an overnight stay. It can even, actually in theory, can be always done in 1 day, but the overnight stay always gives us a little bit of a margin if there's a time pressure in the clinic or on the road as you're travelling from the airport to here. It also gives you time to relax, to have food, to look around. After the first visit you're tired. Most people are really tired after they have the implants. You don't want to be jumping on a plane if possible. And on the last visit, when we fit the permanent crowns or the permanent bridge, you can then wake up the next morning, and if something doesn't feel perhaps particularly right or a little bit sharp, you can still always come back here. We can make amends. we can change that bridge slightly, or if you want the bridge slightly changing in shape, we can also work on that very last visit, if you stay overnight. So I hope that little bit of information has helped you. Once again, if you have any questions, please get in touch. This is Daniel Shaw. I am the founder of dentalholiday.co.uk. I live here, not live in the clinic, I live basically in the town, but I'm here directing the clinic, so I'll hopefully see you soon, and have a great day. dentalholiday.co.uk.